Welcome to the Mindset Mile podcast, the show that'll leave you empowered to take action towards becoming the turned up version of your already awesome self. I'm your host, Aisha Zaza, and I'm so glad you're here. Let's go. Hey, friend, and welcome back to another episode of the Mindset Mile podcast. I am so excited about this conversation today. I have a very special guest, Dr. Chris Pieton, who is going to be sharing with us some really valuable information on pelvic floor health. So, Dr. Chris, welcome to the show, and thank you so much for being here.
Thank you for having me. Super excited to share a conversation together.
I want to just dive right in because I have a long list of questions for you. And I want to make sure that we're getting all of it because I am just from like the common person. I feel very passionate about this topic just because I am more into like the fitness health, field. And people do tend to ask me a lot of questions around pelvic floor health, of which I am not an expert in. I know maybe a little bit more than the average person, but especially after having my own kids, I had never said the word pelvic floor more in my life.
Totally.
So I'm excited to talk about it. Please tell us a little bit of like, what is the pelvic floor, and just give us some layman terms of the functions of it.
Totally. So the pelvic floor is this significant group of muscles that span the base of the pelvis. And they basically kind of serve as a support hammock inside of the pelvic bowl. And they're supporting all of our internal organs that live above the pelvic floor. But the pelvic floor muscle group itself is also working with the other neighboring muscles that span all the way out to our hip, our abdominal wall, our spinal muscles, and serve a lot of important functions. And so a few of those are bowel and bladder control and sexual function, which a lot of people would at least usually be able to assume or infer, even if they didn't really know anything about this group of muscles. But the other big job that most people have no idea about the pelvic floor is that it's actually a really important part of our core team. And so most people think of their core as just the abdominal muscles, and that's only one of the four key players on that team. Our core team is actually your pelvic floor, your abdominal muscles, your spinal muscles, and your diaphragm, which is that main breathing muscle that lives in the base of your rib cage. And so all four of these muscle groups help to connect our upper body to our pelvis and create support for our whole body while we are in motion for all of our day-to-day activities, as well as fitness-related activities. So if our pelvic floor is not working optimally, it's not only going to impact bowel and bladder function and sexual function, but it also significantly impacts our body's ability to move well. So it has a lot of really important functions for our whole body, or what I like to look at and say is your pelvic health is a really important vital sign of how well your whole body health is working. And it gives a lot of intel if any of those functions are feeling challenged. This is where, we want to be looking at the pelvic floor, but we also want to be looking at what's going on in terms of those other teammates on that core team, because they often are linked when we're having pelvic floor symptoms.
So I'm based off everything you just said, this to me is not a part of the body that needs to be treated or looked at just for people who have had babies. Is that correct?
Totally
this
correct.
Is an everybody topic.
This is an everybody topic. Everybody has a pelvis. Everybody has a pelvic floor. Yes.
So what exactly is a pelvic floor exam?
So when I am working with patients, a pelvic floor exam is taking a look at the external tissue of the perineum. If it's a lady, we're looking at the vulva and also the external anal sphincter and looking at the tissue on that first superficial layer. And then that also includes an exam doing an internal look at the muscles. And this can be intravaginally or interrectally, depending on where someone is having symptoms and having, let's say pain or dysfunction. And then that's giving us insight into, hey, what's the baseline of the pelvic floor? Can it fully contract? Can it fully lengthen? Do we have challenges with either of those phases? Also looking at what is its coordination with those other muscles of the core team that I mentioned. And so we have different assessment tools that we're looking at to say, hey, what are our breathing mechanics when we are contracting or lengthening our pelvic floor? Are we bracing a lot of other muscles in our body to try to get the pelvic floor to connect, or can we do it on our own, and a number of other things? But that gives a really good baseline of what's going on and helping me to better determine what does this patient need. And then these are similar tools too if we have, a male patient. Obviously, the entry point for an internal exam is different, but interrectally is an option to be able to explore the pelvic floor and to be able to assess all of those same things. And then they have some other different muscles, obviously externally, they're different than us ladies. But all of these muscles, can be impacted when we're having pelvic floor symptoms and can create pelvic pain in any or all of these tissues, as well as deeper inside. So pelvic floor physical therapists are specialists in being able to assess all of these important structures to determine what is going on at the muscle level, but also there's a lot of nerves that supply all of these tissues too. So nerves can be injured or impacted. They can also be, having increased tension and tightness in any of these tissues can impact circulation to these areas, irritate nerves, create pain, symptoms, all kinds of things. So having one of us on your healthcare team, if you're having any symptoms in this area, is really helpful to rule in and rule out what is going on from a muscle standpoint, and then having physicians to be able to rule in and rule out the organ system contribution. So do we have bladder problems? Do we have, more internal rectal issues that need to be ruled out? Do we have other things? If we have a uterus, do we need to be making sure that other things organ system wise are working optimally? So kind of tag teaming with these different specialists, because muscles and organs both need to be ruled in and ruled out to make sure that other things aren't going on. But oftentimes when people are having any type of challenge with bowel and bladder control, pain with intimacy, as well as pain with movement in and around the pelvis, having a pelvic floor PT contribute to an assessment and an eval to look at all of these things is really valuable, because oftentimes when patients go to the physician level and they're ruling out all these organs and saying, hey, there's nothing wrong here, and doing imaging and MRI and saying, hey, everything's all clear, a lot of physicians are not trained in understanding the pelvic floor component and how the pelvic floor can actually create symptoms in this area as well. And so not a lot of people are then referred to a pelvic floor PT to take a look at the muscle component. And this means that a lot of the general public is not getting access to someone with my expertise to help them further with these symptoms. So we can have a lot of challenges that just persist without actually solving the root cause, which often there is a pelvic floor component that needs to be looked at.
Okay, so I guess my next question after all of that is, what are some common pelvic floor symptoms?
Yeah.
Because you
So there's
explained a lot of like what you find going on inside the body, but like, what does that translate to the everyday person? Like, what are they feeling? What are they experiencing?
Yeah. So there's quite a big bucket of symptoms that can show up as this cluster of pelvic floor symptoms. But the most common ones really are challenges with, let's say, increased urgency and frequency of urination or bowel movement. We can also have pain with any of those activities. We can also have discomfort with intimacy. So this can be with insertion, this can be during arousal, this can be with an orgasm, or, after an orgasm has occurred. Any and all of those phases require the pelvic floor muscles to contract and lengthen and coordinate quite a bit for all of those activities to feel available and comfortable. So these are other areas that we are supporting patients through. And then also if we're having any pain or discomfort around the pelvis, so think pubic bone discomfort and pain, think hip and groin pain, think tailbone and kind of low back pain. All of these deserve to have a pelvic floor physical therapist explore these, because I can't tell you how many times patients will have persistent back pain and hip pain that doesn't resolve with traditional orthopedic PT. And that usually means that there is a pelvic floor component that's actually creating those symptoms instead. And so these are just a few of the more common ones that many individuals will be experiencing and are pelvic floor contributors.
Okay. I think that's really helpful to know. And when I think when most people, I guess, think of strengthening their pelvic floor, we've always been taught Kegels, right? Or Kegels. I don't know if I'm saying that right.
Mm-hmm.
Kegels.
Tomato, tomato.
Is
People say it both ways.
right.
Yeah.
Is that really, I mean, what else can one do around strengthening their pelvic floor? Like educate us on how you help your clients build pelvic floor strength.
So Kegels are absolutely one way that people can create some strength at the pelvic floor level. And they are still a tool that we use as pelvic floor therapists to assess with an internal exam an individual's ability to contract and lengthen their pelvic floor. However, our pelvic floor is much more sophisticated than just squeezing and letting go. And also because of the fact that the pelvic floor is working within this larger team of muscles, like I mentioned, if we're having pelvic floor challenges and we are just doing Kegels, that is not going to address the entire team that likely is being impacted and creating these symptoms. So Kegels are overprescribed and are not appreciating the sophistication of this integral system. So there are times when I am recommending a Kegel for my patients, but for the vast majority of the time, I'm actually looking at all of the other teammates. I'm looking at what is someone's breathing, coordination and capacity, because our diaphragm is actually the bigger influencer on the pelvic floor, which is going to impact its ability to support and to be strong for all of our activities. I'm also looking at what is someone's hip strength and range of motion at their hip. Because if we have a lot of tension and tightness there, we can be doing all of the Kegels, but we're not actually going to get optimal pelvic floor strength because the tightness in the hip is going to prevent the pelvic floor from being able to work most optimally. So it's really about the best way to strengthen our pelvic floor is to strengthen the whole team and maintaining and nurturing good, strong, like muscle strength training around the pelvis. So all of our major hip muscles, all of our, good like abdominal strengthening, our back strengthening and our lats and our diaphragm, like all of those are the bigger players that are influencing how strong our pelvic floor is going to be able to be, and also how well it can show up for all of our activities. So Kegels are just one very small piece of a much larger puzzle rather than being the entire solution.
So I heard you say lift weights, right?
Yes. Lift.
Thank you for echoing this. Because I see this and everyone's probably like, okay, we get it, Aisha. But I am so intrigued to hear that that has such a big role in ways that one might not think like, oh, well, I don't feel like back squatting today because whatever, I'm tired or it takes too much energy or whatever. But
Mm-hmm.
you don't realize like how much it's not just about like the physique that you get when lifting weights. It's really about the holistic approach and like the holistic health that comes from strength training. I'm such a big fan of that.
Totally. And I think this is, such a big contributor for pelvic floor symptoms in general, like not having either education and or consistency or knowledge that, hey, strength training is important for our overall health, but especially for maintaining our pelvic health and just longevity for all of the adventuring that I hope everyone is able to do throughout all of their years. But in order for any muscle to maintain strength, we need to be doing strength training and we need to be doing it regularly. The pelvic floor is no different, even though it's not a muscle that maybe most people know about, or it's not a muscle that we can easily see, right? It's not one of those beach muscles, but it is absolutely impacted by how much strength we have in the whole body. And so our glutes are a really important piece of this that are supporting kind of the back half of the pelvic floor and the pelvis. The inner thigh muscles are a really important supporting team underneath the front portion of the pelvic floor and up through the front of the pelvis and lower abdominals. The hip flexors and the hamstrings are also two other really big important muscle groups that are influencing the position of the pelvis underneath the rib cage, which is then creating a different environment for that diaphragm and pelvic floor to be communicating well or not, depending on how all of those muscle groups are coordinating and how much capacity they have. So pelvic floor strength is full body strengthening, not just around the pelvis, but that's a big influencer. So if we can, oftentimes people go, what's the best exercise for my pelvic floor? Honestly, squatting lunging, and doing it under load. Those are my faves, and those are ones that are happening on a regular basis in my office. Most people are not expecting me to hand them a kettlebell and go, here we go.
Mhm.
And obviously, there are some other nuances, but it's like, hey, we need to lift in order for our body to be able to be functioning well. And that includes everything in and around your pelvic floor.
Love that approach.
Yeah.
I love it. Thank you.
Mm-hmm.
Okay, so the next question, I want to speak to the postpartum
Yeah.
women, okay?
Yeah.
And this is actually a question or a topic, I should say, that just kind of fires me up a little bit because it has to do with the greater medical field and like the standards that we have in the US and the lack of communication between specialists like you and doctors, right? But
Right.
there's this infamous 6-week checkup postpartum, which seems like such an arbitrary timeline because
Mm-hmm.
everyone has such birth experiences and heal at such a different rate. But
Thank
let's
you.
say a woman goes in and gets the green light from their doctor that it's okay to start working out and having sex again, but they don't feel right, or they do experience pain with either, right? And I
Mm-hmm.
feel like it's really common that for women to think that something's wrong with them, that they're not healed by the right timeline. What is, or walk us through exactly what your body, the inside of your body looks like still at 6 weeks postpartum, and what can someone expect like at that point to be able to do without feeling discomfort or pain?
This is such an important topic and one that also gets me equally fired up. So thank you for asking about it because I think the 6 week all clear is very unclear. And it is unclear because those tissues are nowhere near done healing. Yet the phrase of all clear gives the perception that you should be all good to go. And this also then puts the burden on the individual and the general public to navigate the rest of their recovery without any guidance or recommendations. And this is really problematic for a lot of reasons, but postpartum care literally begins and ends for most people with that one 10-ish minute appointment. And the only amount of healing that has truly occurred by that 6 week mark is the most superficial wound closure. Wound closure maybe being across your abdominal incision if you had a C-section, a vaginal tear possibly because the vast majority of individuals that have a vaginal birth will suffer some type of tear in that birthing experience. And so again, it's just the top layer of the wound being closed is like literally all that has been concluded at that 6 week mark. In the orthopedic world, you would never be cleared for any type of full clearance to exercise without any type of guidance or whatnot. You would be absolutely referred and are to a physical therapist, and you begin rehab like week 1 after a major medical event. And yet we don't honor the same type of guidance or support for women postpartum, which is really problematic and completely unkind to do to women. And then we wonder why we continue to have all of these pelvic floor symptoms that persist, not just after the 6 week mark, but literally persist for usually multiple decades of that individual's life. Because I had to go to 3 years of medical school to get my doctorate in PT and then do additional years of specialty for pelvic floor education to be able to translate that one liner of advice of listen to your body and ease back into things. That should not be on the general public to have to navigate without any type of plan. Women should be referred to us so that we can manage and pick up where that all clear, meaning you're all clear in terms of 0 signs of infection, is really how it should be reframed. You're all clear to now be referred to a pelvic floor physical therapist who can now guide you back through your healing and recovery and onto movement with a plan rather than go at it, good luck, bye.
Right,
When your body
right.
has
I
just
know.
gone through like the most significant thing ever. And to your point, the other part of everyone is starting at a very different point at that 6 week postpartum visit. It is not black and white of everybody starting off at the same point. So I often tell my patients too, if I'm lucky enough to meet them in their prenatal period, I go, look, Your 6-week all clear is the starting line of healing, not the finish line. Also, it took 3 trimesters for you to grow your human. You deserve at least 3 trimesters postpartum to help your body have enough time and to honor the healing and recovery. And we're going to be building strength through that. But like, there are about 3 trimesters that your body is going to be going through healing, rebuilding, and recovery. And reframing what is a more realistic timeline for that. 6 weeks is not it. And then to even look further beyond that, I go, what really women deserve is to have a pelvic floor physical therapist on their team from the beginning. Just like you're having regular prenatal appointments with your birthing provider, you also deserve to have regular checkups with us to be guiding all of the changes your body's going through, guide movement and exercise, help you to be able to maintain strength work that is appropriate for each individual through their whole pregnancy, to support all of those things, because the common aches, pains, pelvic floor symptoms, leaking, all of that kind of stuff is common because women are not being given good support, rather than it being something that you just have to accept as your new normal through pregnancy and also postpartum and beyond. All of these things continue to be common because of the lack of postpartum care and the lack of prenatal care around this, rather than it being because women aren't doing the right things. It's because they're not being given good education or support.
That was such a heavy yeah, oh my gosh. I hope that this reaches like all of the women who need to know that they should be seeking a pelvic floor physical therapist, because I had no idea. I'd never heard anyone mention that they had a pelvic floor physical therapist through pregnancy,
Yeah.
or even after pregnancy. And really, you were the first person that I even saw have like a social media presence and like was educating, around this topic.
Yeah.
And as a woman, or as really anyone, you don't know what you don't know. And it would be
Totally.
really beneficial for our medical system to at least refer, right? Like,
Totally.
here are some resources after you leave this appointment, whether that is programs, right? Like people that offer pelvic floor rehab, whether that's like a self-led program that you can do at home, or whether that's to a therapist. I just feel like we're not given the tools. And so it's really helpful hearing you mention all of this and stress the importance of it.
Totally.
So is it common, or do you see women who don't give birth vaginally that have either opted to or needed to have a C-section that experience pelvic floor symptoms
100%.
after giving birth?
Yeah.
Yeah.
And this is another area that, again, I totally understand general public's knowledge of thinking, oh, I had a C-section, so therefore that means that I won't have any pelvic floor symptoms because my baby didn't come through that way. Your body still carried a baby for all of your pregnancy. It still carried you for all of those months of pregnancy. And also, if we had an emergency type C-section, usually there may have been some pushing or an attempt through a vaginal delivery, which is still going to impact all of those tissues, which can then result in pelvic floor symptoms as well. But even if we have a non-emergency C-section, a planned C-section, the pelvic floor is still not, quote unquote, spared in that process. Your body, again, back to that core team that we mentioned, that core team goes through so many changes and a significant surgery in this case in order to accommodate bringing a baby earthside. So pelvic floor symptoms are still absolutely prevalent and common, regardless of the mode of delivery. And that's another big piece that most individuals are really shocked to learn and shocked to feel in their body of like, wait, I had a C-section. Why am I having all of these symptoms? And so this is, again, where a pelvic floor PT can absolutely come in and help you. I do so much with patients around, scar tissue massage and education around their healing and recovery, because scar tissue adhesions across a C-section and our lower abdominals can create a lot of challenges if those tissues aren't moving well. And if there is scar tissue that restricts our range of motion, our ability to twist, bend, extend, all of those types of things that can create a lot of back pain, a lot of difficulty engaging our abdominals well. This can also create a lot of increased tension and tightness in the pelvic floor, which is then also going to contribute to a lot of, pain in that area, a lot of increased in Pain with intimacy is what I see a lot too. Also, an increase in leaking and constipation challenges because of that increase in tightness. So that pelvic floor gets fatigued more easily, and then that creates these other things. So every person who goes through pregnancy and birth and postpartum deserves to have access or at least a consult with a pelvic floor PT so that we can give you tools to be able to support yourself and, to your point, know and learn about your body in this way, because we don't know what we don't know. And it shouldn't be on the general public to have to navigate these things on their own.
Do hormones have any impact on our health at all? Like, how, let's say someone doesn't go through birth in their life, and doesn't really have any type of like big injuries, right? Over the course of our lives, our hormones are changing. Does that have any impact at all? And what do some women that maybe go through menopause, like that see you, what are they saying about the symptoms that they're having?
Yeah, so this is another area of pelvic health that a lot of people don't know, but estrogen is such an important hormone for our pelvic floor and our pelvic health. So, estrogen, first and foremost, one of its many jobs is actually to create vaginal lubrication throughout the vaginal canal and the external vulva tissue. As we are in states throughout our life where our estrogen is in a lower state, this is very common as we're going through perimenopause, menopause, and postmenopause. And so this actually creates thinning and dryness to those tissues. When we have more thinning and dryness, that means that these tissues have less flexibility. This also means that there is more thinning of those tissues, so they are more prone to kind of these little micro tears and injury. And so this then results in a lot of individuals experiencing pain with intimacy, pelvic pain with day-to-day activities, as well as an increase in UTI, urinary tract infection type conditions. And so this can then be a really big challenge for people in their quality of life. And unfortunately, when they go into the general, medical system, not enough physicians are educated on these pieces, unfortunately. And so they're being given a lot of antibiotics unnecessarily. They're being given, the recommendation of, well, this is just what happens. Like, have a glass of wine and like try to relax a little bit more, and that maybe that will help. These are like literal things that multiple patients of mine have been told. And so this is minimizing the bigger problem of a lack of pelvic floor education within our medical school system, as well as minimizing that this is just, again, common and therefore just what is going to happen to you through your later decades, and that we just have to kind of suck it up. But connecting with a pelvic floor PT, once again, we have so much more knowledge in this area. And topical estrogen, which is basically a prescription for a lotion that has a certain prescription of estrogen in it, to be able to apply across the external tissues as well as into the vaginal canal, solves this issue.
Wow.
Yeah.
I had no idea.
Yeah. And it is such a game changer for so many patients. And this is also a really big game changer situation for women postpartum, because the sudden drop in estrogen postpartum is very similar to what women are going to experience as they're approaching menopause. So another big reason why women early postpartum also have a lot of pain with intimacy when they return to that is because of this hormonal change. And if we are breastfeeding, in order to maintain prolactin hormone for milk production, that means that estrogen significantly is kept low in the body. This then creates vaginal dryness and pain with intimacy and can increase risk of increased UTI type conditions. And so, like, once again, vaginal estrogen is the solution to this problem, but not enough women are given access to this, are told about this, have providers proactively prescribing it for them. So this is another piece that I'm regularly educating my patients on and referring them back to their doctor to request it. And, sometimes this also becomes a challenge if the provider still isn't really versed in it. They might still push back and go, oh, I don't really know about that. I don't know if you're a good candidate for that. There is literally like hardly any reason for someone to not have access to that, or even like side effects of vaginal estrogen, other than the time that it takes to apply it and having to go like refill the prescription. And so these are really important things that women deserve to know about so that they can take a more proactive approach for their health and know how to advocate into the medical system because of this challenge of a lack of education all the way around.
Yeah. I really hope that women feel seen after hearing you say that, because honestly, one of the first things that I thought of as you were talking about the lower estrogen levels, months postpartum,
Yeah.
I had a lot of conversations just with my mom friends about their lack of desire to even have sex, like
Also,
months.
yeah.
And the conversation always is like there's always an internal like, oh, I don't know what's wrong with me. I don't feel like having sex, or like I have no
Right.
libido or low libido.
Right.
And it's like all of these, we can shame ourselves so easily, not really understanding that there is actual hormonal, it's not you, it's your hormones,
Right. It's like there are
basically.
biological reasons for this. Yeah. Like,
Yes. It's not just that you are touched out and tired and like have a newborn. It's a like biological, no, there is something bigger at play here. And just even understanding that, I feel like, is empowering to be like, this is normal. It's not abnormal.
correct. Yeah. And that it's, to your point, like it's not a me problem, but rather a problem of not having this information up front to know. Also the confusion, like we were saying, back to the all clear and being told like, okay, you're all good to go, all this stuff. It's like, oh, so that a lot of people internalize that, and I get it, saying, oh, that means that like I should be ready to want that. I should be ready to like want to do that
Mhm.
again. And there's just so many reasons why the vast majority of people do not feel ready to do that physically and emotionally. Also, your tissues are not fully really ready for that either. P.S., they require at least 12 weeks of more extensive healing versus the 6. That's only like halfway through one full cycle of tissue healing. So your body kind of knows that it's not ready for that
Yeah.
for a good reason. And then biologically speaking, evolutionarily speaking, in order to maintain nursing and support the new life that you're taking care of, this is also another reason why those different hormone changes are happening. And again, to what you said, it creates this lack of desire and a low libido because of all of that. And so being able to help normalize that, saying it's okay if you don't feel like you want to participate in those things. But this is another piece too that I'm regularly discussing with patients and even inviting partners to come to PT appointments at times to lessen the burden of you all having to be the person that is always disseminating this information back into your family and with your partner. Normalizing, like, hey, these are the things that are going on with your partner. And, she just went through a really big physical change. We have a new baby. We have these hormone things. We have, how does that impact her pelvic floor? Why she may be having the symptoms she is, and like, how can we give the partner some better tools to also have education and be better equipped to know how to support all of that that's happening too. So these are other pieces of the pelvic health conversation that I think deserve to be included as like part of the pregnancy education, birth prep, having this
Mhm.
discussion about a return to intimacy with each other also after having a baby, etc.
I love that. So to me, what I gathered from this conversation or discussion is that a healthy pelvic floor equals quality of life goes up.
100%. Totally.
Yeah.
Yeah.
And that you should consider having a pelvic floor therapist on your team for pre and postpartum is what I mean. I
100%.
didn't, and I wish I
Yeah.
did. And I'm like, I feel pretty fortunate just having like the knowledge and information that I do about exercise,
Yeah.
but I still feel like this is way more robust than just, okay, get back to, doing some planks and V-ups and just strengthen that core. It is so much
Right.
more than that. So
Yeah.
do you have any resources online that people can access?
Absolutely. So there's a couple different ways that, I've been creating, resources for the community at large, and just recognizing kind of what we're talking about, this really big gap in access to this information. And so I have information on my Instagram account. I also am continuously adding more content to our free YouTube channel. We also have some online courses that we're creating. So we have a pelvic floor birth prep course that is really awesome for people to go through kind of throughout their third trimester to help prepare and learn how to create opening through their hips and learn different breathing techniques to create lengthening through their pelvic floor, to know how to prepare themselves for laboring, for pushing, and early postpartum pelvic floor care and recovery. And then we also have a return to exercise program postpartum. So where should you start? What should you be doing when someone says, oh, you're all clear, but actually giving a step-by-step movement plan that can be self-paced and digestible for people to follow as well. I recognize that even if people may know about pelvic floor PT, there still can be a lot of barriers to access this type of care. It could be due to how many pelvic floor PTs do you have in your geographical area. Sometimes there are some, sometimes there aren't. Or maybe there are financial barriers to be able to access one-on-one appointments. Maybe there's scheduling barriers in terms of needing to return to work and, managing childcare and not being able to go see somebody. So wanting to create different resources for people, for all of those things, because you moms are doing so much all the time, and it can be challenging, even if you do know what you need or want, but being able to fit it in. So creating different ways to learn, have different touch points, and ways to access this material. So yes, all of those things.
That is so helpful. So what is your Instagram?
So it is my last name, Pieton, PT. And then the YouTube channel is Move with Dr. Chris. And then my clinic website has all of the other courses that I mentioned. And I forgot to mention too, we also have a monthly newsletter that is free that talks about a different pelvic health topic every single month, that is not just about birth and postpartum, but all phases of our pelvic health life. And so you can sign up for that at our website also, and that's pietonpt.com.
Pieton, spelled Pieton.
Correct.
Awesome. Well, Dr. Chris, thank you so much for your expertise and just pouring into the Mindset Mile listeners. I really hope that, again, this is sent and shared and saved and all of the things, because it's so important. And everybody run to Dr. Pieton's Instagram page at the very least, and give her a shout out, because this was so helpful. Is there anything else that you wanted to add?
I think two things. One, thank you for having me on the show, and also using your platform to be another space and voice to elevate the discussion around pelvic health, because the more of us that can have these conversations, the more information that gets out for all of us to be able to be better stewards about our pelvic health and overall health. And then also just wanting to echo that, it's never too late to reach out to a pelvic floor PT, no matter how many years you've been having pelvic floor symptoms, or no matter how old your babies are. It's never too late to get stronger. And so these are the other really important pieces that I'm regularly sharing with the community and with patients, that you don't ever have to just deal with your pelvic floor symptoms. You deserve to have support around them so that you can have the highest quality of life for yourself, but also for all of the important relationships that you have in your life. Your pelvic health is a really important vital sign of your overall health. And so we want to make sure that you have the best vitals possible so that you can live your best life too.
Amazing. So that ship has not sailed for anybody, is what I'm picking up.
100%.
Good.
Yes.
Awesome. So helpful. Thank you so much, Dr. Chris. And thank you, friend, for tuning in. I hope you enjoyed this episode. I cannot wait to see you next week. And until then, make it a great day.